session from the post-service department of the head of service. I'm sorry, I have a cold, so voice is not so audible, but I believe that everyone can hear me. My name is Bissy Roland, and I'm your host today. I acknowledge the presence of members of the Association of Lagos State Retired Heads of Service and Permanent Secretaries that are on the call, distinguished retirees, and 7 officers who have joined us today. As we all know, the weather is very, very cold, so I believe we're all keeping warm and taking warm. Yeah. Our topic today is from cloudy vision to clear sight, talking about cataract. And we have in the house with us Dr. Koya Babafemi. He is a medical doctor and a public health professional whose work sits at the intersection of clinical care, health promotion, and population health. His professional journey spans broad experience in general patient management, which includes specialized eye care. Dr. Koya is a graduate of the Lagos State University College of Medicine, and he has nearly 2 years of experience in ophthalmology, where he provided comprehensive eye care, he managed ocular diseases and contributed to the prevention of avoidable blindness. Dr. Koya has participated in numerous public health trainings, technical working groups, and multi-sectoral health initiatives, which covered maternal and child health care, communicable and non-communicable diseases, malaria control, immunization, health policy, health communication, and disease surveillance. As a clinician with a growing public health perspective, Dr. Koya remains committed to initiatives that improve lives, strengthen healthcare systems, and advance equitable access to health care. Excuse me. Dr. Koya, good morning.
Good morning.
Yes, good morning. Welcome and thank you for joining us today. So everyone, kindly listen attentively and take notes. And when it's time for questions and answer session, you can put your contribution or your questions in the chat box or raise your hand. So we'll call on you. So I wish us all a fruitful session. Thank you. So Dr. Koya, you can go ahead, please.
Good morning. Good morning, everyone. All protocols duly observed. As earlier introduced, my name is Dr. Koya Babafemi. I'm very passionate about preventive health, also very passionate about eye care and eye health generally. Our topic for discussion this morning is from cloudy vision to clear sight. I want us all to know that cloudy vision is one of the most common symptoms that patients experience and would complain in the eye clinic. And we know that there are a whole lot of problems that can cause cloudy vision. I've tried to make it a little simple by differentiating or trying to narrow down on what the causes can be. So I've divided into cloudy vision due to illnesses caused by the eyes directly, and cloudy vision that are caused by other things. And so if we take this first subset, which is cloudy vision due to eye disease, we know one of the most common causes ranges from cataracts, which is a very common condition, mostly amongst the elderly. In fact, there's a popular saying that says, all men who live long will die with some degree of cataracts. So the only thing that can probably make you free from not developing cataracts is if you don't live old enough. Other common causes are conditions like dry eye disease, which is a very common illness to amongst elderly people, where the eyes do not produce enough fluid for lubrication. So they develop dry eye disease, and they can also come down with cloudy vision. Another common causes, or another of the causes of cloudy vision, also people who have refractive errors. That means people who are short-sighted or people who have long-sighted. Um, they can also complain of cloudy vision. Another very common condition that causes cloudy vision is glaucoma, which I know we must have heard about. And then lastly, people who have retinal problems. Aside, like I said earlier, aside causes that are due to the eye generally, we can have other causes. For example, people who have diabetes, yes, they can also have some form of cloudy vision. Even it's been reported also that some people have also eventually developed a stroke, and the first set of symptoms they experienced was cloudy vision, which then progresses to sudden onset loss of vision, and then eventually by the time the patient presents to hospital, they say the patient has a stroke. So of all these causes, I've decided to talk about cataracts today, and as seen on the screen, I'll be going through this outline, introduction, also try to talk a bit about the epidemiology, especially in Nigeria. What are the things that poses as a risk or that causes cataracts? I will also try to classify a little. I will also a little just talk about how it develops, and then go on to tell you about what kind of features that this condition presents with that you need to look out for so that you can go to the hospital for evaluation. Then some of the tests that will be done for you, and most importantly, how it's treated, and then some complications that can arise from treatment. I will also talk about some myths according to my little experience that I've heard on the streets of Lagos. So, just after this introduction, I'm going to show a picture of what the ice is like, or the structure of the ice, so we can get a very true picture of what I'm trying to describe. Or better still, please, can you move to the next slide? Next slide, please. Okay, so this is the diagram of the eye. The best way to understand this diagram is assume that this is the front and this is the back. And this is exactly how your eyes looks like if split into two. And then you can see more like a cross section of the eye. And we can see that most anteriorly in the eyes is the cornea, and then the iris, and then the lens. And then we can see that full fluid-like cavity We describe that as the vitreous chamber, and it contains what is called the vitreous humor. It's like a gel. And then most posteriorly, we can see the optic nerve. So ideally, light rays move, or anything you want to see moves through all these layers before it's being interpreted in the brain as vision. Now, cataract itself is a disease of the lens, and we can see the lens. I think the best way to look at or to imagine the lens is the lens just looks like your vehicle windscreen. Again, your windscreen has to be clear to be able to drive and see what's just in front of you. So ideally, the lens, it's clear, it's transparent, it's biconvex, right? It's not supplied by any blood vessel, so we say it's avascular. And if we look at this lens very well, we can see that to the top and to the bottom, we can see something labeled as ligaments. Let's imagine them to just be like a rope. They help to hold the lens in place. That rope-like structure is described as the suspensory ligaments. They help to hold the lens just in place, right? Um, what does this lens do? It helps as soon as light rays are coming in from the front, it passes through the lens and down through vitreous, and before it's eventually interpreted as vision, right? That's basically what the lens does. And like I described, it is transparent. So again, the synonym of what I've described the lens to be is like your windscreen. If, for example, you wake up in the morning and the windscreen looks foggy, or maybe this tactics that is being employed by robbers where they say they throw some eggs on the windscreen, anything that makes the windscreen of your vehicle cloudy is going to affect vision. That's the same thing that happens in cataract. For some reasons, the lens is no longer clear and light cannot pass through, and then you cannot see as clear as you used to. That's the best way to describe what happens in cataracts. Okay, so please, next slide, please. Next slide, please. Can you hear me? Oh, okay. So I went on to say this also describes like the epidemiology of cataracts in Nigeria. First, I want you to know that cataracts can be congenital or acquired. Congenital being that we have people or young children that are born with cataracts, or that develop cataracts at a very young age, or acquired, meaning that this person was like you and I, no cataracts from birth, and then for some reason they develop cataracts due to age, or maybe another very common way people develop cataracts is if they have like trauma to the eye. uh, you know, Trauma to the eye too can be very synonymous to somebody throwing stones at your windscreen. They can be a crack or they can be an insult. So basically, people have also acquired cataracts from trauma. I want us all to know that it's a common cause of blindness worldwide, accounting for about 50% of blindness all over the world, and constitute about 43% of blindness in Nigeria, meaning that if you see 100 blind people in Nigeria, 43 of them probably got blind due to cataracts. However, it's also stated that the vision loss that happens with cataracts is reversible, meaning that if you develop cataracts, you cannot see, and then you have surgery, you can see, meaning that it's reversible. And basically, like I described, opacities occurring in the center of the lens affecting vision, right, more than those in the periphery, meaning that, again, if we look at the lens as a circular structure, if the cataract is more concentrated in the center of the circle, is more likely to affect vision than if you have maybe a cataract that is below or to the side. We can see that place, that exact position where the arrow for lens is like if you have a cataract just sitting there, we will say that that cataract just lies in your visual axis. So those type of cataracts are more likely to impact vision than cataracts that develop maybe to the top or below. That's basically what that statement is like. So let's go straight into the causes, especially the causes are, I'm going to be talking majorly about acquired cataracts. Like I said, cataracts can be congenital or acquired, meaning from birth or as we go older. So risk factors or causes, um, age is the most common cause. I earlier said at the beginning of this lecture that if you live old enough, you are likely to get cataracts. The only thing that can save you from cataracts totally is if the person dies young. We also know that some disease conditions can make you develop cataracts earlier. Disease conditions like diabetes, people who have low calcium, people who have some metabolic disorders where they have problems with processing glucose. It's called galactosemia, galactokinase deficiency. And people who have conditions where they have too much uh, iron in the body, that's called Wilson's disease. When the iron levels in the body are so elevated, those iron can go and deposit on the lens, causing it to lose its transparency. And then I also mentioned some other conditions like Fabry's disease, monocidosis, which are not really common conditions in Nigeria. But we need to know that apart from age, if you have other medical conditions like DM, low calcium, elevated high iron levels, you can get cataracts. Again, as earlier mentioned, trauma is another cause, especially in young people, right? When they have direct penetrating injury, maybe young kids. I think one of the most common trauma that we used to see in the eye clinic where I was training at that time was young kids in school with pencil sharpener pencil while they're just playing during break time. You just see one of the kids hit the other child with pencil. Another common this thing, like in the neighborhood too, when kids are playing and they throw stones at each other, then the next thing, one throws the stone and then it hits the eye. Another common mechanism of injury that I also got to see was these kids with catapults and all. And then coincidentally, one catapult shot straight to the eyes, and then it can cause this. Again, in traditional housing, I think that's very synonymous with the kind of house I also grew up to with this iron spring that causes the door to return when it's open. And we've had instances that when such doors are pushed and then the spring just cuts off for some demonic reasons, it goes straight to the eyes and then causes damage. So all these mechanisms of injury also can affect the eye and cause cataracts. Now, electrocution and electric shock, right? Not so common cases. I've not seen any, but then it's very documented that when people have electric shock, they can actually develop cataracts from that. Again, lightning too. This what's the name? Thunder strikes and all. Yeah, we've also read in the books that it can be a cause of cataracts. Um, the fourth cause I'm going to discuss also is inflammatory conditions, like a condition called uveitis, where you have an inflammation of the blood vessel layers in the eyes, right? And if a patient gets uveitis and it's not properly managed, they can now go on to develop a cataract after that. Please, next slide, please. Next slide, please. Okay. So again, this other risk factor accounts for the congenital causes. Now, again, I had mentioned that um, people can be born or kids can be born with cataracts. And the common causes of that is when they are in their mother's womb, They can have some insults, some infections that is called like the touches complex, right? And then by virtue of their mother being infected with any of these infections, it can go on to affect the child and cause cataracts. Example is rubella. If the mother gets rubella while she's pregnant carrying the baby, there can be cataract in the child. The child can be born with cataract. The touches there um, is an acronym for a whole lot of intrauterine infections that women can have, and then if they have it, they have a chance of the kids they're carrying in utero to have cataracts. We also know that people have developed cataracts from drugs. So you can have cataracts from drug-induced conditions. And then drugs that have been known to cause cataracts include steroids. You see again, steroids have people use steroids these days for a lot of things. Some people use the steroids to get fat. They say they want to add some weight. They go to their local pharmacy and then it gives them steroids. Again, too, we've had steroids being added to body creams. We all want to look very beautiful, looking very glam and all, but then these steroids that is being infused in all these creams and all, yes, they've been shown that exposure to them can cause cataracts. Again, some kind of eye drops called Miltix, drugs that are used to treat a particular heart-related condition called amiodarone has also been shown to cause cataracts. The congenital abnormalities too, if we have kids that are born with Down syndrome, Lowell syndrome, myotonic dystrophy, dystrophia myotonica, yes, these are like conditions that I'm sure we all must have had or seen a child born with Down syndrome. Those kind of kids too, they have an higher incidence of developing cataracts. Other causes too that has been shown to cause cataracts include smoking. So, those who smoke, apart from the fact that they can develop lung disease, they can also get cataracts. Exposure to radiation, um, exposure to radiation, hereditary related problems have also been shown to cause cataract. A particular common condition too, like dermatitis, yes, has also been reported to cause cataract. So these are the most common risk factors, stroke causes that has been shown to cause cataracts in our environment. So we will now go on to talk about clinical features. Those who have cataracts, what will they notice? Or what is it going to be like? Okay, so first, they will have what is called reduced visual acuity. Basically, what this means is their vision just gradually begins to reduce. Um, this visual loss is usually progressive. There's no pain. And they just see that there's an increased need to use a brighter light, meaning that um, that person can see normally, but after a while, like the way my old folks too behave at home, they have to shine torchlight to be able to see very well. Or maybe to see somewhere, they have to move maybe from a dark room to a much more brighter room, right? Um, Again, too, it's also very noticed in them that when the light is very bright, they have what is called, it looks like the light is scattered. So they cannot really also see clearly, even when the light is so bright. Um, Another condition or another clinical feature is what is called glare. With this glare, the best way to to think about it is when we wake up in the morning and we see that reflection of maybe like this when the sun is rising, and then your window is open. There's a way that reflection of the sun can appear maybe through your kitchen. It doesn't make it clear like it should be. So that's the best way in which I can describe glare. It looks as if the vision is being covered by by a ray of light, but not necessarily real bright light. So pictures or images do not appear crystal clear. Instead, they have like a background fog. Exactly, a background fog. So that describes glare. Another clinical feature that people have described is they can just have problems with differentiating colors. They can have color vision problems. Also, there could be a change in refraction. Yes, this is a very common. You will see people come, they'll say, um, prescription lens mi yẹn, ó dà gbé 3 years ni mo ti gbà á gbẹ̀yìn. Ó dà gbé mo ní láti ṣe another glasses. So they keep changing their prescription lens, because they feel like there's a need to, because their vision is not like they they used to know it to be. So they usually have like a myopic shift or an hypermetropic shift. Yes, what that means is myopia is also called short-sightedness. So because they have cataracts, the short-sightedness keeps getting worse, and there is a need to keep changing prescription. And then if they are long-sighted, it keeps getting worse, and there's need to keep changing their prescription lenses. Whereas it's not really like maybe their primary condition, which is their short-sightedness or long-sightedness, is just the cataract that is making it like that. Again, some people have very pronounced cataracts, meaning that when you just shine light on their eyes, you see the whitish thing, you know that this person has cataract. So that describes wide pupillary reflex on direct illumination. Please, let's go to the next slide. Okay, so we can see I put a picture. You see that when the lens is crystal clear, if you shine light to it, you can see the bright red light that shines back to us. That shows that this is a good red eye reflex. But with the person who has cataracts, if you shine light into their eyes, you can see that you can't get the feedback reddish that shows that the lens is transparent. Instead, you can see the cloudy lens, and you can see how it obscures vision. So basically, when the person comes to the clinic, the patient has what is called like a lamp examination, and then the doctor can see that, oh, this person has a cataract on their lens, and that is why the eye appears to be like this, or why they aren't seeing well, and all of that. Next slide, please. Okay, so when someone has cataracts and then it's not treated, they can it can go on to develop other conditions. Like because of the cataracts, they can now have what is called cataract-induced glaucoma or lens-induced glaucoma or a lens-induced uveitis. Or for some reasons too, the lens can just dislocate. Or you can even sometimes, due to how severe the cataracts might be, they can have a rupture of that lens, and then it subluxates. So those are the complications that can happen from developing cataracts and not treating them. Next slide, please. Okay, so eventually there's cataract, and the best way to manage this condition is to book an appointment with your doctor, an ophthalmology, in a registered eye clinic. The doctor is likely to check what your vision is. That's what the visual acuity test is like. And they want to see what you're currently seeing and be able to take notes, right? And next, they will do a pupillary reflex test, which is synonymous to what I described. They shine light into your eyes. If the lens is clear, they can get that reddish glow back. But if there is cataract, they can't get that reddish glow back because the cataract obscures that light and that is being shown, right? They can ask that you also check your eye pressure, which is called tonometry. And then they try to measure the power of your lens or the power of your eyes generally, so that by the time they do surgery and they want to put in another lens for you, right, they will know what power to put. The doctor also performs other tests like fundoscopy to check your optic nerve, the back of the eye, if it's good enough. Because again, people can present with cataracts and then still have other problems. So your ophthalmologist will try to look at the problem holistically, and before they narrow down that, okay, what this patient has is just cataracts. So they also want to check other tests. They want to do a full blood count for you. They want to check your blood pressure. They want to check your blood sugar. Again, we want to check whether you have syphilis, you have HIV, or you have hepatitis. All this your doctor is going to do so that at least they can also identify if there are other problems that you have aside cataracts. So that takes us to the myths versus the facts. Before we go to that, does anybody have any questions so far? The myths also, I want it to be a very interesting part, because I know everybody must have heard about cataracts, and I want maybe one or two people to share what what they've heard, what they think, or also what they've heard, especially in terms of treatment. So if you want to ask a question so far, or you want to share some of the things you've heard, please let's just permit like one or two people to do that.
You can raise your hand so we'll mute you from our end, or you can type in the chat box, please.
Hello. Can I speak?
Yes, please go ahead.
Hello, ma.
Good morning.
Good
morning, ma.
Where you're the son of Victoria. Good morning. What about these people, Mwadop, or Jandis? They are all advertising in the media. I've tried just one of their, but I've not a difference from before. What do we do again? Thank you.
Did you get that, doctor?
I didn't hear that clearly, but I mean she's probably referring to some of these supplements and all that they advertise on social media these days. And with the advent of media, people
Yes.
have different products that are treating different conditions. So I think she's probably referring to one of those products. I don't know the product specifically, but again, I know that it's
Mwadop.
Moadoc. Okay.
The
Okay.
product is Mwadop.
Okay. Is it an
Mwadop.
herbal
I've
supplement?
used one dosage, a packet.
Okay.
Yes. But there has not been much difference.
Okay. Thank you, ma, for noting that and for sharing that with us, ma. Any other person?
Good morning.
Good morning.
Good morning.
Good morning, ma'am.
Yeah. My own idea, my own experience with this is I go to clinic every time I was given an appointment. I will go. I was given about 2 eye drop, do salt, Bremoton, and
Brimonidine?
another one. Hello, sir.
Yes,
And
Please go
that drug
another
ahead.
one
that
at
you are
night.
talking about, Drufagan. Drufagan. Brimonidine.
Monidine, yes. The Monidine, I use it
Morning
3
and night.
times a day. In the
Okay.
morning, in the afternoon, and at night. Then do salt twice. And there's another
Duo salt.
one,
Duo
do
salt.
salt. Do salt
Yeah.
twice a day. One by 7 a.m. in the morning and by 7 in the evening. Then Exalo Lotan, Zalotan. That one,
Zlatan. Zlatan.
okay, Xalatan.
Yes, it's Zlatan.
Zalatan. Okay, that one at night. But
Okay.
these days, if I go out, I still feel cloud. It wasn't like
Direction is
that
cloudy.
before. I feel
Yeah.
cloud that I may not be able to see people very well. What should I do?
Okay. Okay. Okay, let me just respond to that question directly. So mommy, I want you to know that those eye drops you were given is not to treat cataracts, right? So all of those eye drops you mentioned are not for cataract treatment. So please go back to your ophthalmologist so that they can also tell you exactly what they're giving you those eye drops for, and then they can follow up your care from that. Thank you so much, ma.
Thank
Um,
you.
okay, so um, let us now go back to our lecture. The
No,
myths.
sorry, doctor, please.
Okay.
Madam Belinda,
Yeah,
Okay,
good
let's take that.
morning,
Okay.
good morning, ma.
everyone. I want to find out, is it a myth that smoke from firewood and all these kerosene lamp people use to sell in the market causes cataract?
Okay, so I can also respond to that directly. I don't think there's any scientific documented cause through that mechanism, right? Um, so I want to say that I don't want to say it doesn't or it does, right? But then I know for sure that even if it does, maybe it accounts for very little number of cases. It's not a well documented cause of cataract.
Thank you.
Okay, so please let us talk about the myths and the facts. Um, Again, not until when my eye care experience, which lasted for about 2 years, I don't think I ever knew what was called traditional eye drops. I never heard about it, even despite the fact that I grew up in a very low resource setting. I just didn't, I just never heard about it. But my experience in the eye clinic, I had patients come and then I saw eye drops that were traditional and, they were bottled. So, and then by the time I interacted with these patients, that is it like you people bought like containers that contained normal orthodox eye drops, and then maybe you people put an agbo inside? No, she told me like no, there was a traditional healer somewhere around Agege is the one who gives the eye drops. So then I knew that there's something called traditional eye drops, and then she went on to say, oh, they said this eye drop can dissolve cataracts. We know that that is not true. Another myth that I also got to know is like people will say, "Oh, eye surgery, it's dangerous. Once you have surgery on that eye is gone." It's not true. So what are the facts? We know that there is no eye drop that can cure cataract. There is no eye drop that can cure cataract. That is known fact. We also know that, like with every surgery, there is improvement in surgery. So I can tell you for free that the way cataract surgery is being done in 1999 is not the same way it's being done in 2026. So there are new and modern surgeries, and I can tell you that some of the aim why all these procedures are improved upon is that, you know, it is the modern ones are safer, and then the complications that come out of it is lesser. Please, let's go. So those are the myths and the facts I want to discuss. That will take us to dangerous practices that I've heard, which is the next slide. There is a common practice, though I don't know how rampant it is in Western Nigeria, but then again, I think in the northern part of the country, it's called coaching. And it's an ancient method of treating cataracts. And what do? They use like a needle or a thorn. They put it in the eyes. And what they plan to do is to push the lens into the vitreous. Please, can you share back the image of the eye like I showed earlier so that people can get a picture of what I'm saying? So we can see this lens in that's being labeled. They use a needle from the front of the eye. That means they pass through the cornea and then the tiny hole between the iris, and then they get to the lens. And what they do is to push the lens backward into that jelly cavity as earlier described. And then they say they have treated, or that is treatment for cataracts. Yes, maybe where they push the lens in, right? That vision or the axis is now clear. But then again, pushing the lens into the vitreous has been shown to cause a mirage of complication. By the time you are seeing that patients in the clinic, they must have developed a condition that we call endophthalmitis, and they have more than 60 to 70% of losing vision completely on that eye. So that's a very common practice, which I term dangerous, that people do. Please, can we go back to our previous slide? So that's coaching. And then, people also patronize a lot of traditional or herbal healers. They drink agbo, they take traditional eye drops, they give them other charms like atari, alligator, something, and all that. Or again, some people also resort to their spiritual healers for prayers, um, spiritual water. Yes, I know God that we serve heals all disease, but it's one of the things that we know or that we've heard. Again, also a lot of harmful substances into the eyes. I heard about people putting breast milk into the eye. I heard that they say even the early morning urine, they say the one that is very concentrated, if you put it, it will help to dissolve it. Some people talk about putting honey into the eye. Some people also go and put kerosene. Some people battery water. And even some people cow urine, all sorts. I want us all to know that all these do not work. In fact, I think I always ask questions like, what's the school of thoughts behind this urine? We all know that the body is actually, there's a reason why the body produces urine. The urine helps to take out the waste. So why will I really think that a waste product can now be a cure for whatever problems I have in my eyes? So I think that's a way to look at it. Please, let's be wary of all these harmful substances. They do not work. I can also see from the chat box where somebody said the myth I heard from a neighbor was that cataract is caused by looking into the sun, and she advised the sufferer to wash her face with early morning urine. Please don't let us do that too. It doesn't work. It doesn't work. It doesn't work. Okay, so let's go to management or treatment. Next slide, please. So now, when you visit the ophthalmologist and then all these comprehensive assessments are done, your ophthalmologist can now assess the level of your cataract. For some people, they will say, oh, this cataract is not matured enough, meaning that we don't need to go on and do surgery for this patient right away. So in those kind of people, we can give them glasses to improve their vision while we keep monitoring the stage of the cataract. And when the cataract is matured
That's
enough,
the topic of
we
today. Right.
sorry, ma.
From class
Moto
B.
G, please, can we mute? Can we mute,
Stop
please?
with you, Abi.
Okay, so we now tell the patient to use glasses, right? Because the cataract has been assessed and it's not mature enough for surgery. Again, we can say, okay, why don't you make your house a little brighter? Not too bright, but we can increase the lighting in your house, in your office, just to help to improve your vision, because we know that the stage of maturation of that cataract is not matured enough for surgery. And then eventually, if you reach that stage, or by the time we're accessing you, we think the cataract is matured, the definite treatment for treating cataract is surgical extraction. There's no any other. So that's the management. We use glasses when we assess. When you first come to clinic, we assess your cataract. If it's not mature enough, we can say, okay, let's give you prescription glasses to help improve your vision, increase lightning. But by the time we assess you again, or even at first visit, if we think the cataract is matured enough, surgical extraction is the only definite treatment for cataract. Next slide, please.
Yes, that is true.
Don't drink cold water for this weather. I'm telling you. Stop.
Please, can we
That water
mute
is
your
too
mic,
cold.
please, ma? Okay, please. Next slide, please. Okay, so indications for surgery, right? So like I mentioned, it's not everybody who comes with cataract that we're just going to say, okay, yes, it's surgery. So first, if your visual impairment is not significant enough, your cataract is not matured enough, we won't do surgery, right? If you have other eye-threatening disease, like maybe with the cataracts, you have conditions like diabetic retinopathy, which is common among people who have diabetes, or people who have other problems with their retina with the cataract, and then we know these people need surgery. And for those of us too who are very glam and glitz, like the big mummies of Lagos or big daddies of Lagos, and we don't want people to look into our eyes and be seeing a whitish, for cosmetic purpose, the doctor can also take out the cataract for you, right? If the cataract is causing a big visual difference between your two eyes, and that can also be an indication to do surgery almost immediately. Please, next slide, please. So we have different types of cataract surgery. We have the intracapsular cataract extraction. That one is no longer used. It's a more older method. Please, next slide, please. Yeah. So basically, the two methods that are currently being employed is the extracapsular cataract extraction and a more newer method called phacoemulsification. So basically, what these two surgical procedure describes generally is that cloudy lens is removed and a new lens is put inside. The best way to understand this is in my motor vehicle, the windscreen is broken. And when I take it to Ladipo, they will remove the old screen and put a new screen. That's basically what treatment is like. Please, next slide. So, again, I told us that the intracapsular cataract extraction is an old method. It's no longer in use, so I won't dwell much on it. But I will just talk more about the extracapsular cataract extraction and the phacoemulsification. The extracapsular cataract extraction, what basically is that so we need to know that even the windscreen or the lens is being put inside the case. So in the extra capsule, so that case that houses the lens is what we call as the capsule, or that's why that surgery is called extra capsular, meaning that case, we just put a small cut on that case, we remove that bad lens, and then we put a new lens. That is basically what the extracapsular cataract extraction is like. Phacoemulsification is a much more newer method, meaning that in this method, we make use of ultrasound, just like the ultrasound that we use to do scan, right? You make a small cut. You use ultrasound to take out that lens that is bad, and then you put a brand new lens. That is basically what all this surgery describes. Let's take it one after the other. Can we go to the next slide? So the small incision cataract surgery, right, is an example of an extracapsular cataract extraction. It's a manual method, like I said. Basically, you make a small cut in the case that houses the lens. You take out the cloudy or natural lens, right? And then the incision that you make on that case is so small that you don't even need to suture it. We can see that the entire length of the suture is about just 7 mm. You just take away the cloudy lens and then put in a new lens. I have a picture in the next slide. So can we see in the first step, can we see that small object that is used to cut open the bag or the case that houses the lens, right? And as soon as we make that small incision about 7 mm, in the step 2, you can see the small instrument we use to remove that cloudy lens in that position. And then in step 3, can we see we have a new lens and we just insert it. No suture, nothing. New lens in place, new windscreen in place. Patient starts to see immediately post surgery. The next one is phacoemulsification, which is the next slide. Is a modern cataract surgery technique. And in this time around, rather than using manual instruments or no, you use an high frequency ultrasound. You just make a small incision also on the cornea and the lens, right? You can see even smaller incision. The incision is typically about 2.2 to 2.8 mm compared to the manual method, which is about 7. You make it very tiny, and then you put in the high frequency ultrasound probe. You use it to dissolve and also take out the lens, right? And then you put in a new lens. We can see that there's faster recovery, less postoperative inflammation, right? There's very reduced risk of wound complication. And then patients even tend to see better because, very small surgical incision. The method of removing the lens too, very, very touch, right? And then we can see what the outcome is even better. I have a picture in the next slide. So can we see? Very small incision. Can you see our ultrasound probe? We just need an incision that can let us insert the probe. You can see by the time we put in the probe into, it breaks that lens within it and sucks it out like a suction. And then, the whole cavity is clear. Then you put in a new lens and that's it. Surgery over. Like I said, the phacoemulsification has less complication, faster recovery, and even the outcome of surgery too is a lot better. Next slide, please. So some complications can happen, right? Like with every surgery. But I can tell you that these complications are not so serious like that. And then the likelihood of developing a complication too is dependent on where we do this surgery and the expertise of the surgeon. But then again, ideally, if we do surgery, cataract surgery in a well regulated center, the risk of complication is very low, very low. And then with some of the complications patients can have, like endophthalmitis, which is infection inside the eye, which is more common with that local method I told you that they do, that is more common in northern Nigeria, the couching. But we know that with real cataract surgery, the risk of developing endophthalmitis, macular edema, corneal edema, bleeding in the eye, retinal detachment, and many other complications is very low. So surgery is safe, I can assure you. And then again, according to the method of surgery that you decide to take, if it is the phacoemulsification, complications are even lower. I want you to know that this phacoemulsification or the extracapsular cataract surgery is available at the Lagos State University Teaching Hospital, LASUT, Institute of Eye Care. All of these services are being offered there and is one of the best centers in Lagos where you can take up all your cases and then you can be assured that your outcome will be great. And thank you very much for having me. And this will be the end of this lecture. Thank you very much.
Thank you very much, Dr. Babafemi, for the intensive presentation. The myth part is what really got me interested. The lady that said if you look into the sun, it would you can get cataract through that. That was quite funny, yeah. Okay. Yes. Thank you everyone for still being on the call, and we've had some questions during the presentation. But if you have more questions, you can please raise your hand or put it in the chat box. But there's some comments in the chat box right now, so I'll just take some of them. So, Doctor, you can answer them. Okay, someone says, when water is coming out of your eyes and the water is thick, what can I do?
Okay, so there are many causes of that. And like I tell people, when you have any ocular complaint, rather than just treating yourself or seeking for opinions from these various eye clinics that we have all over the place, go to a registered center, have proper assessment, and let the doctors take it up from there. So again, like you mentioned, you know, water coming out from the eyes, it can be dry eyes, it can be a whole host of plenty things. So I think you should have it checked, and then following the examination, the doctors will advise you on what to do, ma.
Can I speak?
Yes, please go ahead,
Hello.
ma.
Yeah, my video, they wrote your video is stopped. So all the things they are showing there, I couldn't see anything since.
Your video is what?
They said your video is stopped. I don't.
Oh,
I've not all the things he has been showing. I didn't see anything.
oh,
I
that
didn't to
must be
disturb.
from your end, ma. But if you can leave your number
Ah,
on, I said that must be from your end, ma, because nobody has given that
okay.
complaint. Yes, ma. But if you can leave your number in the chat box, I'll send the slides directly to you. Although we usually send to the retirees platform, so I'm not sure if you're on
Uh-huh.
the platform, but you can
Yeah,
you can
I'm on
drop.
literary platform.
Okay, no problem. We will send the slides there.
Thanks so much.
You're welcome, ma.
Yes.
Okay, ma, I have a question, ma. Can I go ahead?
Yes, please go ahead, ma. Good
Okay, ma.
morning.
Good morning, ma. I have an elderly person that has done this cataract operation. But I think maybe he went to a wrong place and it was wrongly done. So it's like he's not seeing again.
Oh,
Is it possible to redo the operation for him to see?
So
Thank
that
you.
patient has to go to a proper center for evaluation. We need to know exactly why the patient is not seeing. Again, the bad thing about vision, or for every organ too that is two in the body, is that there's a reason why God made it two. The sad thing about vision is vision loss cannot be regained. That's
Yeah.
vision totally lost, cannot be regained.
Jesus Christ.
What I mean by that is that we learned that again. You remember in our lecture, if you're having vision loss due to cataract, right? We know that what is causing that is there is a blockage. The lens is cloudy. We also see that from our treatment. If you take out the cloudy lens, that's all. You put in a new transparent lens and patient can see, right? So that's an exception. But we know if you've lost vision due to glaucoma or diabetic eye disease or any other disease and there is no more vision, it cannot be regained. So
Yes, sir.
let this patient go back to a proper eye center. Let them evaluate. Is it like maybe you said the patient had his post-surgery? What happened post-surgery? What's the situation now? Is it that vision is entirely lost? Then they will take it up from there.
Thank you, sir.
Yes, you can tell the patient to go to LASUT. Like I said, the LASUT Eye Care Institute, very fantastic place. Majority of the new methods are being done there. So please, you
Okay.
can harness that facility. Thank you so much.
Perfect.
Thank you.
There's a question, although you might get it, I don't understand it. Please, what is your opinion about causative factor being deposits of metabolic waste, like carbohydrates and protein on the lens?
Okay, so like I mentioned, we have metabolic causes of cataract. That's upon where diabetes, Fabry's disease, or any disorder of metabolism can develop till you get on the lens. I don't think there's even if there's any way to stop it, it will be more about dietary control. Like if you have DM, have very good control of your diabetes and blood sugar. If you have all these galactosemias and all, we can say you should run away from certain types of. But then once the patient has now developed cataract, you can only take out that lens, nothing else. I think that answers that.
Okay. Some people are asking for your contact. So I've dropped it in the chat box already, but I'll
Okay.
call it out. 0818 279 5836. 0818 279 5836. Like I said, I've dropped it in the chat box. So, doctor, can they make calls or is it just WhatsApp?
No, they can. If I'm available to pick, I will pick it.
Okay.
Can I ask this question again? Not related to cataract, but glaucoma.
Okay, please do.
Okay, sir. So I use Xylis, and they said I should use 9 p.m. Why 9 p.m., not other time?
Mm, please just 1 minute, please, ma'am. So I think in the medication Xylis, it contains latanoprost. And so basically, it's been reported that in a large number of patients, it causes eye redness post-surgery, post-administration. That is why most people say use it at night towards bedtime. That's basically why I think we tell people to use it at night. So at least it won't be like maybe when you use it during the day, people will be asking you, oh, why is your eye red? Or why is your eye itchy? Aside that, I don't think there's really any other reason. Maybe you can also seek more information from your consultant, but I know that's basically why they say use Lacalopus, that's Xylis, Xylis T, and all of them at night. So I don't think there's any other reason why you should use it at night. We know that it is better tolerated because it can cause some eye irritation, that's eye redness, and itchiness. So if you just use it and you go to bed, it's better rather than use it in the morning and you are itching your eyes or your eyes is red and you say, mommy, you know, show you and all of that. So that's why, ma.
Thank you, sir.
Yes.
Can I come in, please?
Please go ahead, ma'am.
My
Yeah,
hands
thank
are
you.
up.
I am Carrie Sakisoya, and I want to thank the lecturer for the wonderful teaching today. I learned a lot. But I want to ask on the issue of glaucoma. Can they still operate glaucoma?
Yes.
Because I don't know when they say glaucoma can still be operated. I think it's
Yes.
very dicey.
In fact,
But
there are many levels to this to glaucoma surgery. Many
oh,
levels.
okay,
That's
okay.
another reason why I'm passionate about eye disease. I'm a young man and I have glaucoma myself.
So
So I use medical
Wow.
therapy. But then I
okay,
know that you can, you, so the first set of surgery, like the trabeculectomy, and then if your pressure is not control. So in fact, even before surgery, they first start with laser. ALT and all. Then from there to open surgery like trabec, and then to the next step where you now have to start putting tubes in the eyes to make sure that the pressure comes down. Right?
okay,
So there are multiple levels to treatment, and all of this treatment, like I said, is also available at the Eye Institute in Lasut. So if the consultant thinks you need surgery, please go ahead. You'll be fine.
okay. Because I went to Anzilla. I think
Okay, Asila, okay.
yes, Anzilla in Agege.
Yes.
Somebody directed me there, and I went there, and I did all I could do. But do you know, at the end of the day, the doctor confirmed. He said, "Your left eye is gone." Ah, my left eye is gone. He said, "Yes, it's gone," and that was the whole thing. He said, "They gave me all the whatever that can be seen myself." But I was so bothered, and I didn't know what to do. And I knew I was just in a circle of friends, and they were talking about there's one woman somewhere, is she's using this, she's doing this and all that. I want to tell you today, I had to go to that woman. I got the contact and I went to that woman. Believe me, that my left eye that was not even seeing, I knew it wasn't saying. To God be the glory. I was only applying what the woman gave me, you understand? And the woman said I should be applying it every 3 hours. So God be the glory. That left eye, I can now see with it. At least I can
Wow.
see with about 50% now. So
Mhm.
and that's exactly the woman that was talking about somebody that went to do an eye cataract surgery, and the thing went, just gone like that. I don't know what your institution or whatever, I mean, your organization, I'm talking about the ophthalmologists, that you want to do to help people outside there. All those people that are quacks, I don't know how you are going to work on them and then just make sure they're just opening people's eye anyhow the way they should do it, the way they are
Wow.
doing it. I don't know how they are going to help people there. Because you are talking about lawsuit, you will not be surprised. A lot of people will go there and they will not see the actual treatment they are looking for. You see that the money will be too high for them to bear. I don't know, but something has to be done. All these quacks, you just have to get them out of the market so that a lot of people will not go blinded. I just thank God for my own. I went to Anzilla and it's confirmed it's going to be done. But today, I thank God the Lord has restored my eye a little bit. And
Ma,
hello.
was it a herbal medicine you used or it's orthodox?
I won't say it's Harvard. The person is a professor. I mean, the woman, she's a professor. You understand? A professor of ophthalmology. In fact, by the time I told her about what they told me at Hansela, the woman was just telling me, we have been telling all these people that is not the training we have given them. You can't just be pronouncing to people that their eyes are gone, because it could have to another thing in their health. This one, the woman said she did it herself, in a container, and it's working very well. I've directed a lot of people there and they have seen difference.
Yeah.
And if you have people like that, I think a lot of people will be helped out, because I went to this place before. They asked me to go and bring 1.5 million. That was a long time. Only God knows how much they'll be asking now.
Yeah,
They
yeah.
said,
Eye
okay, you have to
foundation.
do it. And do
Correct.
you know, when they told me that I should go for operation, this is this very well eye foundation in Ikorodu. I went there and I got to that place, and the doctor told me, Madam, you have both cataract and glaucoma. You just have to quickly go and do it. But I want to tell you this, one needs to be very careful. They gave me one eye drop. That eye drop, I had to throw it away, because immediately I began to apply it inside my eye. In fact, the kind of pressure I had, I've never experienced it. I had to throw that thing away. You know, but the core thing I want to say is please use all within your power based on this teaching today to just help us get the quacks out of the market so that a lot of people will not be falling victim. Thank you for listening.
Yeah,
Yeah, thank
we
you very
were
much.
very appreciative of your experience. I'm glad you also said you sought care from a professor of ophthalmology. I don't know what must have been done, or I don't know what condition you have. Again, too, personally, I'm more focused on advocacy, and I know a lot of my teachers also do a lot of advocacy. And then I also speak very highly of the Lasso Eye Clinic because, again, I know the place is equipped with very experienced and very skilled professionals, and I can vouch for what the level of care is like there because I was there for a while before I left. So, but basically, it will be the or the responsibility of government to eradicate quacks. And then we all know that another thing that has made all these quacks thrive also is doctors are few in the country generally, and even in the subspecialty of ophthalmology, I can tell you there are even a much more lower number of doctors. So I think basically what I will advise is just make sure that no matter the eye condition you have, seek care in a well-registered center. That's very important. It's not just about, oh, I have some eye complaints and then I'm walking on the streets of Agege and I see Otimi and Sons Eye Clinic and I walk in there and I think that's where I get care. Yes, I'm not trying to say there are no very good private eye clinics, but I think again, if a center is good, you would have heard one or two from your friends or from the news. Let us just go to well well registered and well described eye clinics. Thank you.
Please, can I come in? I have
Okay.
my hands raised.
Yes, Madam Oyefunsho Renuga.
Thank you very much. Good
Good
morning.
morning, ma'am. Sorry for keeping you waiting.
Thank you. Thank you for this enlightening presentation. My question is, I want you to elaborate on how lightning and thunder can cause cataract and what we can do when it's raining with this heavy lightning and thunder. So that, because I know that when there's lightning, you tend to close your eyes. And then for the person that said, if you look in the sun, maybe we could correlate sun and lightning causing cataract. Please, further explanation.
Okay, let me explain to the best of my knowledge, right? I might not be able to describe the mechanism in which that happens directly, but I don't think what they are talking about is I'm seated in my house or I'm seated in my car and then there's thunder and then because I'm around or maybe I heard the thunder, I can develop cataracts. No, I think what they're trying to describe is we've all heard about when they say thunder strikes people. I think that's basically the mechanism in which the cataract develops. Just like when thunder strikes people, or when they get, I think the mechanism of thunder is very synonymous to the mechanism of electrocution. Again, what I say is that if you see somebody who has gotten electrocuted by electricity and somebody who's been struck by thunder, you will see that it's very similar. You will see that there's always an entry point. If you examine the patient, you will see where the thunder or the electricity comes in through, and you also see where it exits through. We describe it as entry and exit wounds. You will find it on the person or on the patient. So I think their mechanism is very similar. Probably when you get electrocuted or somebody thunder strikes people specifically, do you get the way our body is can be a conductor of electricity? The way electricity is being conducted in the body probably affects the lens and can cause cataract if that patient doesn't die. I think that's the best way to describe it, ma.
Thank you very much. Thank you.
Yeah.
So
Madam
don't worry, you
Fola,
are safe, ma. Even though
Thank you.
whether there is rain or no, you don't have any issues. We
Thank
we
you.
all don't have any issues.
Amen.
Madam Fola Shade,
Okay.
good morning, ma'am.
Good morning, everybody. Our appreciation goes to the post-service department and to Dr. Babafemi. I just want to collaborate what Mrs. Caris said. I have a 90-year-old mom who had glaucoma. We learned that the left eye was gone and the right one has cataract that could be operated. She did. And immediately after the surgery, she said she could see better. But right now, as I'm speaking, it's about a few weeks after we have gone through different things. Different situations. It was done in Luz by a professor. She has lost that eye. We have gone to the another eye clinic in Solo. Then finally went to Ansela in Iju Road. And well, right now we are trying to say that there are some pus coming out of the eyes to the back of the eyes, and we have to do a surgery to try to bring all that out so that they will not remove the whole eye. So what I want to say is the frequency of which people, elderly people, are losing their eyes to just this cataract, which I learned is just a simple operation, it's so high. So you talked about this phacoemulsification, okay, that it's a better and more modern cataract surgery that can be done. Where can we, which hospitals do you, I know you're talking about Lasut, but when you go there, I don't want to discourage people, but I know I have experiences. But sometimes if we want to save our eyes, we might have to go to the private hospitals. Definitely, I'm going to just contact our sister that just talked, Madam Caris, about this professor. But we have several people that have lost their eyes to this, and we need advocacy too. Trying to help people, but many people cannot afford private hospitals. We go to the public, health centers and our teaching hospitals and all that. And my friend, my dear friend, she's just about 64, 65 like me, had a cataract, one on the first side, the one on the second. And when it is done, the second one nearly went sour. The eyes started looking quarter cast like that. And, it's something that the experience can be so traumatic. So please, I just want you, to encourage us because we are all aging. All of us are over 60, okay? And we will experience this in life. I have a little, but they said it's not ripe. So I am I don't want all those things, this to happen. So I want you to maybe advise us or advise me, or where can I get the best? If one has to pay, let one pay and at least save the sites. Thank you.
Okay. Thank you very much, ma, for that question. I will try to respond to it as much as I can. So first, I'm trying to be very objective with my choice of words. So again, we all know that we're in there are a lot of challenges in our environment, like with our public institutions. I'm sure majority of the problems that you might have with going to general hospitals are the usual challenges everybody has. There's a long waiting time. The doctors are probably not enough, and all of that. But then there's another way to look at it. I usually tell people sometimes that even when a system is not the best, you can still get the best out of it. So I think again too, our hospitals, you can also still use them and get the best out of it. That's one. Two, the fecal emulsification is a much more modern method. It didn't used to be available even at Lasut until about a year ago because you need specialized form of machine to be able to do the surgery, and then you also need somebody who has the expertise. I think it's been in operation in an hospital like I Foundation maybe for more years, and I also know that when it's started in Lasut, I learned they brought in some top retinal specialists from my foundation to come and also train the doctors in Lasut on how to do it. So I know for sure that I Foundation offers that service. I know Lasut also offers that service. Maybe Skipper IQ in Ilukbeju is also a very big um eye institute that I think should be able to offer FICO. I also think maybe top hospitals on the island like Evercare and all could have specialized eye departments and should be able to do eye surgery, but not a lot of centers, I can assure you. And then by virtue of the fact that um, this procedure is being done in our own Lagos own facility, I think your best advantage is there. So you can still tweak the system to get the best out of it. That's what I think. But if you still insist on going private, I Foundation, Skipper IQ are choices that you can make. But yes, I wanted to talk about your mom. So we also know, like I mentioned in my slide also, is that the outcome post-surgery cannot be the same for somebody who has just cataract compared to somebody who has cataract, glaucoma, maybe diabetes, high disease. Do you understand my comparison, ma? The more the problems, the more difficult the outcome can be. If I have a 60-year-old woman now who is otherwise healthy, no blood pressure problems, no blood sugar problems, has cataract, yes, this patient can still go on to have complications, but then I'm not expecting a lot. But if I have another 90-year-old woman who is older first, with old age too, more problems. This woman has cataract, has glaucoma, has diabetes, high disease for 30 years, but maybe already having some retinal problems too. Do you get? The older we get, the more multiple problems you have to face. And that also influences outcome. So I think in the case of her, probably that was what must have happened. Maybe she didn't just have cataract alone. Maybe she had cataract with other problems. Do you get? So maybe that's why it turned out like that. I'm so sorry for how things have turned out, but then I most likely think that that's what must have been responsible, ma. So these are my
Thank you very much. We just felt, from hindsight now, we wish we had not done that surgery because she was still sane, very vibrant, uses her telephone, although very blurry, but at least she still does that. But now she can't do anything. We had to
yes,
get her two caregivers,
yes,
to be helping her because right now we are putting eye drops right before we go on Friday again, eye drop every hour now to see if that the pulse will clear
infection can resolve.
or we have to
Yes,
go for the surgery. So there are some when you assess people and they are aged and all that, maybe they've just advised against surgery. Okay. But
yes.
our
So,
people just want money. They say you have to do this and that. So
mm.
sad. Thank you very much. Thank you.
So sorry about the way the situation has turned out, but I don't want you to think about it like that because again, she could have also had surgery and be fine. That's another way to it. I think it's also very difficult from the perspective of a physician. One of the most difficult situations you have to be taking care of people is trying to make the distinction whether you should intervene or not because it's very dicey. You want your patient to be fine. That's your goal as a physician. But then again, they also exist the risk or that what if this patient is not fine? And so it's a very difficult interface, I can tell you, ma. I'm so sorry for how things have turned out, and then I just hope that things keep getting better from here, ma.
Thank you very much. Thank you. Truly appreciate. Thank you.
Thank you for that contribution, ma. Like doctor said, we're so sorry that turned out the way it did. Yeah. Madam Okiwelu, your hand has been raised for a while. I don't know if you still want to say something. Okay, there's another person. iPhone. Oh, I seem to have lost that. Okay. Is there any dietary restrictions that can reduce eye pressure?
Good body, ma. Oh, okay, sorry.
Oh, sorry, iPhone. Okay,
Yes.
go ahead. Go ahead, please.
Good morning. This is Mrs. Kolawole.
Good morning. Good afternoon, ma.
Good afternoon. Sorry.
Mhm.
The greeting is from across the the other side.
Oh, okay, ma. You're
Okay.
welcome.
Thank you very much. Doctor is a very powerful delivery and explicit. I just want to testify to the goodness of God. Going to government.
Yeah.
I want to testify to my own case. In 2019, when I was diagnosed, I went to so many hospitals, the one in Ikeja, the one in Koya. My said that I go to private hospital to do it. When I got there, they said the two eyes, I had cataracts and glaucoma suspects, and that they are going to do the two together. And I've once heard that somebody did it and the two eyes were gone. I left the place. When I traveled back here, they said they wanted to do it. All those Oyinbo people, they said they were doing this, it's gone, it's getting cancer. I told them, please change my ticket. I'm going back to Nigeria. When I got to Nigeria, I went back to Lutz. What I want to testify is that we need a lot of patience if we are attending government hospital. The patience I had helped me a lot. So one day when I got back to private hospital in Ikeja, I now saw the doctor that was seeing me in Lutz. I greeted the doctor. He answered me and I said, so is the doctor treating me in Lutz that will come and do the surgery here, even despite the high cost that was given? That was why I told my children, I am going back to Lutz. They don't do it well. I say, if hundreds are not successful, my own will be an exception. It will be successful. So the surgery was done a day to lockdown in 2020. And the lockdown helped me a lot. And I was seeing with the right eye that was done. I did another one in Lutz. The second one, I think 2 years ago, for a lot of patients. And today, I am seeing. So clearly with my two eyes, without glasses, I am seeing. And the suspicion of the glaucoma gone. A friend now called me. You gave me this, you testified to this. Can I go? I said yes. She was made a principal, she rejected. But today she went for it, I think last year. That my friend is now seeing and has gone to take the appointments as a principal. So the conclusion I want to, it's not a final conclusion, is that in government hospitals, they have so many specialists. Even if things go wrong in private hospitals, we also run to them. So if we have anybody that has this problem, we should please patronize government hospital with patience, and God will help us in Jesus' name. Thank you.
Amen. Thank you very much, Ma, for that contribution. It says a lot. Right? I thank you for corroborating my claims, and finally by also ending that even when problems arise in the private center, they will still have to refer to government hospital. And at the Lasut Eye Institute, we have glaucoma specialists like my teachers, like Professor Koya, retina specialists like Dr. Ikuma Kama, that can give you very high quality, good quality care.
All right, thank you. The question, is there any dietary restrictions that can reduce eye pressure?
There is none documented. Monitor your pressures. If they're elevated, see your ophthalmologist for care. And then control your weight. Very healthy lifestyle. So if you want to talk about dietary restrictions, I would just say try as much as possible to eat healthy. That's all.
Okay. I have a question. How can you monitor your eye pressure at home? As in, do you have to go to an ophthalmologist?
You cannot measure your eye pressure at home. You need a specialized machine for it.
Okay.
I think in the staff clinic Alausa, the optometrist unit or the ophthalmology unit there, they have a tonometry, the machine for measuring. So that's the only way you can measure the pressure.
Okay.
There's a question on the chat box about cost. When I used to be at Lasut, I think the cost for the manual extracapsular cataract surgery used to be around 200,000 to 250,000. And I think not much has changed about that cost. I know for phacoemulsification, you will need more money. It should be averagely between 700,000 to like 1 million.
Wow. Okay. Can I have okay. Okay, this person wants the contact of the testifier and the contact of the professor. Okay, I think it's Madame Caris or so that gave that talked about the professor. So Ma, you can please put the number in the chat box so that we won't disturb others. Oh, okay, more people want the professor's contact. Madam Caris, if you're still here, I think many people want your attention. Okay. Okay.
Okay. This is Mrs. Caris.
Okay, ma'am. Thank you.
I minuted to somebody directly to our mail. I mean, Mrs. Kelani. I don't know whether she has gotten it. My number is 081 243 08022.
Can you please say that again in case some people did not hear?
Okay, let me send this to the message.
All right. All
Okay.
right. Thank you, ma'am.
Yes.
Okay, another question. Can the elderly have free surgery in Lasut?
I
Doctor.
can't respond to that. I'm not a staff of Lasut, so I can't respond directly to that.
Okay.
I know I can't respond to that. I'm so sorry.
Excuse me. Okay. Is cataract hereditary?
Yes.
So to some extent, yes.
Oh.
Mm,
So is that a yes or a no?
so like I mentioned earlier, yes, especially the congenital cataracts. Like, I told you that some people are born with it, right? And we also know that to some extent, too, in some families, it's part of the kind of history we take. If you say you have a father or a mother who developed cataracts, we know that yes, you can have uh, um, cataracts. So, but why it's not like maybe it's an hard and fast rule, meaning that because my dad had cataract now does not mean automatically I must have cataracts. Do you
Okay.
understand? Yes.
Yeah.
But we know definitely that if you have parents who have ocular disease conditions like cataracts, it increases your likelihood of developing it.
Okay, I'm going to call out the facilitator's number once again because in the chat box so many people are asking. So I don't know, maybe you missed it the first time I called it out. 0818 279 5836. So, doctor, where do you work? Because some people are asking that.
Yes, currently I work
Hello?
with the Lagos State Primary Health Care Board. Um, that's where I work currently, man.
Okay.
Can you hear me? Hello?
Yes, we got that. Lagos State Primary Healthcare Board.
Yes.
Okay. Um,
Hello, we cannot hear. Oh, the line went off when he was introducing. He was telling us where he works. Please, can you
Lagos
repeat it?
State Primary Healthcare Board.
Okay.
Yes, and
Thank you, ma.
his number is on the I've put it in the chat
Yes.
box.
Okay, ma. Thank you, ma.
You're welcome, and I just called it out. Okay, is it advisable to do surgery with is it advisable, okay, to do surgeries in the two eyes at the same time?
No, so according to the best of my knowledge, nobody is going to do surgery in your two eyes at the same time. It's always one eye at the time.
Okay, so when there's surgery on one, you have to come back another
Yes.
time.
Yes.
Okay.
Yes. But that even looks like the best thing to do now. If I do surgery on your both eyes at once, how do I expect you to cope with the healing process alone? You need at least one eye to be able to do at least move around
Oh,
in
yeah,
the
that's true.
exactly.
Okay, is it everyone that uses glasses that would have cataract?
No.
Okay, no.
People use glasses for many other different reasons. People that are short-sighted, astigmatism, long-sightedness, and there are also, and then again, if your cataract is not mature enough, you probably still have to use glasses to improve your vision, pending when it becomes matured, and then you get surgery.
Okay. Somebody somebody had cornea surgery and artificial. Okay, an artificial cornea was inserted. Now she can see again. Oh, okay.
Yes.
Okay.
So that's a whole different topic on its own. The cornea also is a very transparent part of the eye, actually the first part of the eye. And then we now know that again too, especially following trauma, the cornea also heals with scarring, meaning that if it scars, it can also obscure the way light passes through. So now, again, we also know that especially in Nigeria, also there are centers that now do like what is called a cornea transplant, where corneas are being replaced and then patients can see again. So yes, she will see.
Okay. When I scratch my right eye, it makes sounds. What could be the problem?
It makes sound. What kind of sound? Please see your ophthalmologist for further evaluation.
Okay. Okay, Madam Abosede Babala, I hope you got that. Like, you should please see your ophthalmologist. Okay. May I know the side effects of using May I know the side effects of using high blood pressure, okay, maybe medicine for long?
So as we know, with all medications, there are side effects. But I think your doctor has prescribed them to you because he knows that the benefits of using the drugs outweigh the risk. So don't bother yourself about what side effects. Instead, focus on lowering your blood pressure and living longer.
Okay. Okay, I'm just looking up for any more questions. Okay. We don't have any more questions. Any other contribution? We've gone past our time. This is 12:18 now. Doctor, thank you, but I'll call. Would anyone please appreciate our facilitator today? Or I'll just pick on anyone. Please, who will do the honors of thanking our facilitator?
Can I do it, please?
Please go ahead, ma. Thank you very much.
On behalf of
Thank
all
you.
senior citizens on this platform, we say a big thank you to our facilitator. And we also want to thank the Office of the Head of Service for this program that they continue to have. We pray that God will continue to strengthen them. God will continue to strengthen every one of us. And as senior citizens, I know that our mothers will say it's very sweet to be old. It is a metaphor, but God will help us. And
Amen.
I want to ask if the Office of the Head of Service can look at insurance to cover eye conditions in Ilera Eko that most of us, we are trying to hook on. Thank you very much for this enlightening presentation. Now we know how to keep our eyes safe, and we know that with age, we should continue to go for eye examination. I thank everybody. I thank our anchor woman. I thank everybody here present. I thank our doctor, Dr. Koya, Babafemi. God will continue to strengthen you. Thank you, everybody, and have a pleasant day ahead. Keep fit in this rain. Thank you very much. Have a nice day.
Thank you. Thank you.
Thank you so very much, ma. Thank you. Thank you, doctor, for joining us today. And I'm sure when we call you again, you would oblige us.
Yes, I will, definitely. Thank you
All
very
right.
much.
Thank you so very much. Yes, thank you everyone for still being on the call. And you can watch this or listen to this session on our YouTube channel, Public Service Retiree Cooperative MS. Public Service Retiree Cooperative MS. So you just go to your YouTube app and type that in, and to take you to the retirees channel, and you'll see this particular session and other previous ones that we've had. So please help us tell more retirees to join the webinar sessions whenever we have them. And as you can see, we learn a lot anytime we join. Thank you so very much. So like we usually do, we can please all unmute ourselves and our videos and say hello to one another. And I hope you're all keeping warm because the weather is something else. Good afternoon, everyone.
Good afternoon, ma. Well done. Thank you.
Yeah.
Good
Thank you.
afternoon,
God
ma.
bless
Thank you
you.
very much, sir.
More grace, more energy.
You are
Thank
most
you.
welcome.
God
Good
bless
afternoon,
you.
everyone.
Thank you so
Bye.
much. We really appreciate you. Thank you.
Yes, ma.
Ẹ̀mí wá gùn o. Àmín.
Amen.
Lórúkọ Jésù.
Nípa àìsàn ló gbà o.
Àmín
Thank you
Olúwa.
so
Amen.
much. We really
Àmín.
appreciate it.
Yes.
Good afternoon, good afternoon, good afternoon. Thank you for joining.
That I need every second I can get because they literally leave tomorrow. I don't know if they're all the time. I'll come back after and come see. I spent 12 hours underwater. I got this, and I will not leave Peyton. You will not. I'll prove it to you.
Go on. It is thank you.
You're welcome, you're welcome, you're welcome. All right, thank you everyone. So we'll see in August by God's grace, and we'll have more interesting topics that we'll bring to you. So thank you once again for joining, and have a wonderful week, end of week.
Thank you. God bless.
Amen.